What does informed consent for valproic acid, otherwise known as Depakote, look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're going to talk about Depakote, or valproic acid. So in psychiatry, we use Depakote as a mood stabilizer for bipolar disorder, and it's pretty effective, especially for treatment of mania and the mood stabilization, and especially in patients who have a rapid cycling bipolar phenotype, which means that they may have episodes of mania and depression monthly or even from week to week, as opposed to other cases where it might only happen a couple times a year. In addition to treatment of bipolar disorder, it's also used for treatment of migraine prophylaxis as well as seizures. It was originally developed as an anti-seizure medication. So even though Depakote is probably our next most effective mood stabilizer compared to lithium, it's not one that I prescribe all the time, because although there certainly are times where the benefits of the medication outweigh the risks, there are a lot of potential risks to this medication. So you're going to have those side effects that can happen with any psychotropic medication, things like headache, stomach upset, dizziness, drowsiness, fatigue. But there are also a number of other unique risks associated with Depakote. One of the things that patients are most concerned about is the risk of weight gain. Depakote is a major offender of this, and in contrast to some of the other psychotropic medications that we have that sort of level off in terms of weight gain, the Depakote can just keep going and going. Of course, this means that there's increased risk of metabolic issues, things like elevation in blood sugar, elevation in cholesterol. So like something like an atypical antipsychotic, we do have to monitor annual labs for this, including your complete blood count, your comprehensive metabolic panel, your lipid panel, and your hemoglobin A1C, which is a measure of your average blood sugar over the last 3 months. We also have to measure Depakote levels because there is a range in which is considered to be therapeutic as well as toxic. Now, thankfully, Depakote does not have as narrow of a therapeutic index as lithium, which means that we have a wider range we can work with. Whereas with lithium, you really have to be careful. Other things unique to Depakote can include things like hair loss, tremors, edema, sometimes cognitive changes. There can be an adverse effect of elevation in ammonia, which can cause delirium essentially. So sometimes we check that lab as well. We also warn patients about the risk of SI, as well as a relative increased risk in bleeding. Other potential significant adverse effects can include hepatotoxicity, which is why we have to monitor their liver function. There can also be the risk of pancreatitis, which again, we're going to be able to monitor obviously through their symptoms, but through their labs as well. And then teratogenicity, that's a big one. So we know that people who use valproic acid in pregnancy, their babies are more likely to have neural tube defects. And it's a pretty significant percentage of patients who can have this adverse effect. I think it's 4 to 5%. So valproic acid is an absolute no-no for people who are pregnant, thinking about getting pregnant. And honestly, I really try to avoid it in the use of childbearing women in general, because unanticipated pregnancies happen, and being on this medication during those first few weeks can have a big impact. This can be mitigated a little bit by folate supplementation if the patient really needs to take this medication. So there's obviously a lot of potential side effects and adverse effects, but like I said, for some people, this medication is really effective and it's tolerable enough that it's worth taking for that person. Like most psychotropic medications, if someone wants to get off this medication, I recommend a hyperbolic taper because you're going to have increased risk of recurrence of illness as well as withdrawal symptoms if you stop it abruptly. So after going through all this, we would talk about whether or not the potential benefits of this medication outweigh the risks for this individual, and we would make a shared decision from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also getting together an email list for those who are interested in my content, because they may have future courses or resources or offerings, and I want to be able to communicate with you all directly. So if that's you, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.